Hi, my name is Sarah, and this is the informative speech. I will be discussing eating disorders. According to Nutrition and Well-Being A to Z, eating disorders are psychiatric illnesses that result in abnormal eating patterns that have a negative effect on health. I will discuss the three most common eating disorders, which are anorexia nervosa, bulimia nervosa, and binge eating. These diseases have serious risks and negative effects on your whole body. The incidence of eating disorders has increased substantially throughout the 20th century, and in 1980, the American Psychiatric Association formally classified these conditions as mental illnesses, as cited from Nutrition and Well-Being A to Z. Let's start with anorexia nervosa. Anorexia nervosa is an intense and irrational fear of body fat and weight gain, and an iron determination to become thinner and thinner. Anorexia is a misconception of body weight and shape to the extent that the person may feel or see fat even when emaciation is clear to others. Anorexia is diagnosed as an intentional weight loss of 15% or more of normal weight. The amount of food they eat is strictly limited and often to the point of life-threatening starvation. The peak ages for anorexia are between 12 and 17, as stated from Nutrition and Well-Being A to Z. There are many risks of anorexia nervosa. The risks include body dissatisfaction, low self-esteem, dieting, childhood sexual abuse, perfectionism, and family history of eating disorders. It makes you restless and sometimes have insomnia. The effects of anorexia nervosa on your whole body include the severe calorie restriction of anorexia has dire physical effects. When the body doesn't get the fuel it needs to function normally, it goes in starvation mode. It slows down to conserve energy and turns in on itself for essential nutrients. In essence, the body begins to consume itself as the starvation continues and more body fat is lost. The medical complications pile up, as stated from the health guide. The first physical signs of and effects of anorexia are dry yellowish skin, loss of body heat, loss of menstrual cycle, lack of energy, constipation, abdominal pain, growth of fine hair all over the body and face, dizziness, fainting, and headaches. Your hair thins and is brittle. You cannot think right, bad memory, sometimes sad, irritable, fainting, and changes in brain chemistry. You may have blood problems or be anemic, kidney failure, and kidney stones. Your muscles become weak, swollen joints, and osteoporosis. Your skin bruises easily, and you could get cold easily as well. Periods stop, problems growing, and trouble getting pregnant, as cited from the health guide. Now that we have a clear understanding of anorexia, let's discuss bulimia nervosa. Bulimia nervosa is characterized by frequent episodes of binge eating, from 2 times a week to multiple times a day. It is then followed by frantic efforts to avoid gaining weight. In order to prevent gaining weight, bulimics use enemas, misuse of laxatives, diuretics, and self-induced vomiting, as cited from the Gale Encyclopedia of Diets. Bulimia develops during the late teens and early 20s. In contrast to anorexics, most bulimics are at a normal body weight. However, their weight may fluctuate frequently, as stated from Nutrition and Well-Being. During an average binge, a bulimic consumes 3 to 5,000 calories in just 1 short hour. The risks of bulimia nervosa include poor body image, dieting, low self-esteem, weight gain, bloating, swelling of the hands and feet. You may also have a chronic sore throat, hoarseness, and broken blood vessels in the eyes. Your cheeks are swollen, and so are your salivary glands. Also, tooth decay, mouth sores, and ruptured stomach or esophagus. A lot of people who suffer from bulimia use ipecac syrup to induce vomiting. Ipecac syrup is harmful since it builds up in your body over time. The buildup of ipecac syrup can lead to heart damage and sudden cardiac arrest. The effects of bulimia nervosa that it has on your whole body consist of irregular heartbeat, heart failure, low pulse, and blood pressure. Anemia is an effect on your blood. Dehydration, low potassium, magnesium, and sodium are the effects on your body fluids. As for your intestines, irregular bowel movements, bloating, diarrhea, constipation, and abdominal pain or cramping. And irregular or absent period. Some of the brain effects include depression, anxiety, dizziness, low self-esteem, shame and fear of gaining weight, mouth cavities, tooth enamel erosion, gum disease, teeth sensitivity to hot and cold foods. The throat and esophagus are sore, irritated, and can tear or rupture, and blood in the vomit could happen as well. Skin abrasion of the knuckles and dry skin is also an effect. Stomach ulcers, pain, and lastly, muscle fatigue, as stated by the health guide. Now that we have a clear understanding of bulimia nervosa, let's move on to the last eating disorder known as binge eating. Binge eating is characterized by compulsive overeating. It is where people consume huge amounts of food while also feeling powerless to stop and are out of control. Binge eating episodes are associated with at least 3 of the following: depressed, feeling very guilty after overeating, eating much more rapidly than normal, eating until feeling uncomfortably full, and eating large amounts of food when not physically hungry, as cited from the Gale Encyclopedia of Diets. It frequently appears in the late teen years or early 20s. People with binge eating disorder struggle with feelings of guilt, depression, and disgust. The symptoms of binge eating include inability to stop eating or control what you are eating, eating when full, hiding or stockpiling food to eat later in secret, rapidly eating large amounts of food, and eating normally when around others but gorging when you are alone. The higher your body mass index, also known as BMI, the greater your risk for health problems. Your BMI is a measure of your body fat based on your height and weight. The common physical effects of binge eating are type 2 diabetes, gallbladder disease, high blood pressure, high cholesterol, heart disease, and certain types of cancer. Binge eating also puts you at risk for osteoarthritis, joint and muscle pain, sleep apnea, and gastrointestinal problems, as stated from the health guide. In conclusion, anorexia is an intense and irrational fear of body fat and weight gain and an iron determination to become thinner and thinner. Bulimia nervosa is characterized by frequent episodes of binge eating from 2 times a week to multiple times a day. It is then followed by frantic efforts to avoid gaining weight. Binge eating is characterized by compulsive overeating. It is where people consume huge amounts of food while also feeling powerless to stop and are out of control. Finally, anorexia nervosa, bulimia nervosa, and binge eating are the most common eating disorders, as stated from the health guide. And that is it. Thank you for listening.